Hello everyone, my name is Noor and today I have chosen the topic epilepsy. So let's move forward. What is epilepsy? It is a medical condition that causes seizures. These seizures happen because of sudden burst of electrical activity in the brain, which can make a person lose control of their body. As flight attendant, it's important to recognize this condition quickly and respond calmly, because passengers experiencing seizures need help and protection, especially in a limited space like the cabin. Signs and symptoms. When a passenger has a seizure, we might notice a few key signs. The body may become stiff or rigid, and the person could lose consciousness. Their face and neck might turn blue-gray, and they may have noisy breathing or frothy saliva around their mouth. Sometimes their teeth may grind and their muscles might twitch or jerk. It can be really scary for people nearby, but our calm and quick reaction can make a big difference. First aid treatment. Uh, if I witness a seizure on board, I would follow these steps based on our training and the FAM. First, I would help the passenger by reclining their seat, or if needed, I'd gently lay them on the floor. I'd make sure the area is clear and protect them from injury by removing nearby items that could hurt them. It's important to remember, never try to stop the seizure or hold them down. I would try to maintain their privacy by asking others to stay back or using a blanket. Once the seizure stops, I would check their airway to make sure they are breathing properly. Then I would place the person in the recovery position and keep them warm with a blanket. Actions to perform in such emergencies on board. Imagine if we are cruising at 36,000 feet and this happens. As a flight attendant, we should stay calm, call for another crew member, and notify the captain immediately. If there's a medical professional uh, on board, I would request their assistance. While managing the situation, I would also make sure the rest of the passengers feel calm. It's about staying in control and protecting the person having the seizure, and communicating clearly with my team. On board medical equipment. We are not alone, we have medical tools that can help. On board, we have the first aid kit, the emergency medical kit, and a portable oxygen bottle. We also have gloves, the CPR masks, and blankets. These items help us to care for the passengers safely while waiting for the land or for further medical help. How to use equipment to help. After the seizure, I would put on gloves for protection and check their breathing. If needed, I would use the oxygen bottle to support their breathing. I'd place them in the recovery position and cover them with a blanket to keep them warm and comfortable. I would also keep an eye on them and document everything so I can hand over a clear report to emergency responders when they land. These are the references that I have used. Thank you so much for staying along.